Hi, my name's Anita McGahan. I'm a professor here at the University of Toronto, and I'm so excited to tell you about the paper that Keyvan, Vakili, and I have written for the Academy of Management Journal on healthcare's grandest challenge, stimulating basic science on diseases that primarily afflict the poor. So this paper, what we do in this paper is we consider the original logic behind the TRIPS policy, which was implemented in 1994. There's a lot of background on TRIPS, but you can think of TRIPS as fundamentally about the implementation of patent and other intellectual property protections in countries around the world. And the logic of TRIPS was that if you implement patents in countries, maybe even low-income countries, such as the countries of Africa that are low income, India, China, Brazil, low to middle income countries, what you'll do is you'll create a protected market for pharmaceuticals that might be relevant there. So the argument for TRIPS back in the early 1990s was if you put in patent protections in these different countries around the world, that will stimulate the development and trade of new drugs for diseases that are particularly relevant in those countries. Now, it turns out there are two types of diseases in the world, broadly construed, two types of diseases that are worth thinking about. One is what we call non-communicable or non-neglected diseases. You can think of these primarily as cardiovascular disease and cancers. These are prevalent in low-income countries. They're also the primary cause of death in high-income countries. So they're in both types of countries, low-income and high-income countries, but they're I don't want to say exclusively the cause of death in high-income countries because, of course, there are other causes of death, but they're dominant in high-income countries. And in low-income countries, they're also very prevalent. In lower-income countries, low- and middle-income countries, there, however, is also a large portion of diseases that afflict primarily the poor, which are called the neglected diseases. You could think of these as malaria, tuberculosis, HIV, and then a whole list of other diseases like encephalitis, hepatitis, leishmaniasis, leprosy that are relatively smaller. The big three are malaria, tuberculosis, and HIV. Well, one piece of logic for putting in patents in low-income countries is that it would stimulate research and the development of drugs for these neglected diseases, tuberculosis, malaria, HIV. Well, prior research hasn't found very much evidence that TRIPS has led to more trade in these diseases, the implementation of new medicines, and so on. And one explanation for that hasn't yet been tested is that, maybe the basic science necessary to actually develop new drugs for tuberculosis and malaria, maybe that new science has been left unattended because there's been no incentive for research in those areas. Maybe what we need is more time in the pipeline. 1994, the policy was implemented. Some of these countries, it was implemented only as recently as the mid-2000s. Maybe we need more time to do basic science on these diseases. So Keyvan and I examined this question, and what we found was actually evidence in favor of that explanation. We found an increase in research on neglected diseases, both locally and globally, as a result of the implementation of patents and other intellectual property protections in countries around the world. So, for example, you implement patent protections in India, Brazil, and China, we do see an increase in basic science on the diseases that are prevalent in those areas, both locally in those countries and globally, even in places like Canada, the United States, Europe, and so on, in response to the implementation of patents and the increase in the number of patent-protected lives around the world, for which incentives now exist to do research on those diseases. In our paper, we interpret this result as evidence of increasing institutional support in basic science around these diseases. There's a lot more research to do that goes deeper into investigating whether or not those institutions look similar to the ones that we have in higher income countries, and that's what we call for as a result of the paper. Thank you very much for your interest in our research.